Hello, my name is Dr. Angel Kerney, and I am a board certified obstetrician gynecologist and medical director at Excellus Blue Cross Blue Shield. Today, I have the pleasure of discussing an extremely important topic which can be uncomfortable to discuss, often misunderstood, and unintentionally or intentionally dismissed, and which is killing women every single day across the world in general and our country in particular. That topic is maternal health disparity. Throughout this discussion, it will be important to remember two things. You cannot change what you do not acknowledge, and you cannot change what you cannot define. Today, our goals are to define the problem of maternal health disparity in its various forms and to educate our viewers on how to recognize and improve disparities in maternal health. This discussion will be followed by a panel discussion with local experts. Maternal health refers to the health of women during pregnancy, childbirth, and the postpartum period. The word disparity simply means a difference. So, maternal health disparity refers to the differences in the health care of women during pregnancy, childbirth, and the postpartum period. Equity is the quality of being treated fairly and equally. Maternal health equity is ensuring that all women receive equitable care and fair treatment during pregnancy, childbirth, and the postpartum period. What is implicit bias? Implicit biases are associations made by individuals in the unconscious state of mind. This means that the individual is likely not aware of the biased association. Implicit racial bias can cause individuals to unknowingly act in discriminatory ways. This means that their perceptions have been shaped by their experiences, and these perceptions potentially result in biased thoughts or actions. Implicit bias is not the same as racism. Unlike implicit bias, which is subconscious, racism is conscious and purposefully directed. Both implicit bias and racism play a role in healthcare in general and maternal health care in particular. So, what is diversity? Diversity encompasses all of the ways that people are different. Different people bring different information, opinions, and perspectives. Diversity is important. Filmmaker Ava DuVernay said, "When we are talking about diversity, it is not a box to check. It is a reality that should be deeply felt, held, and valued by all of us." I would also add that diversity is not a prepared statement for the eyes of the public for the purpose of appearing politically correct, knowing that it will never actually be practiced behind closed doors and institutional walls. The United States is in the midst of a maternal health care crisis. Maternal morbidity and mortality are on the rise in the United States despite continued advancements in the field of medicine. Expected mothers face increasing rates of pregnancy and childbirth related complications. In the United States, women are 2 times more likely to die from these complications when compared to women in other developed countries. Pregnancy and childbirth complications in the United States have increased among all women by about 9% between 2018 and 2020. In the developed world, the United States is the most dangerous place to give birth, especially for women of color. Black women have pregnancy-related mortality rates that are over 3 times higher compared to the rates for white women. Pregnant Black women are 45% more likely to die in the hospital. The prevalence of delivery complications is 46% higher among Black mothers versus white mothers. Even after adjusting for socioeconomic status, access to health care, and other medical conditions, researchers still found that when compared to pregnant white women, pregnant Black women who were near the time of labor and delivery were 57% more likely to have a stroke, 42% more likely to develop a blood clot in the lungs, 71% more likely to develop heart muscle weakness, and 3 times more likely to die in childbirth. Black, Latina, and Asian women all continue to fare worse than white women when it comes to the likelihood of childbirth complications. The increase in childbirth complications are rising regardless of whether a woman has commercial health insurance or Medicaid. So, what is maternal morbidity and severe maternal morbidity, also known as SMM? Maternal morbidity is any health condition associated with pregnancy and childbirth that has a negative impact on a woman's health. You may be more familiar with the term pre-existing conditions. Severe maternal morbidity rates are rising because there is an increasing number of women who are entering pregnancy with chronic conditions. Pre-existing chronic conditions such as hypertension and diabetes strongly correlate with higher severe maternal morbidity rates and worse pregnancy outcomes. To achieve better outcomes, we need to ensure that pre-pregnancy care is easily accessible and equitable for all women. Additionally, prenatal care and ongoing postpartum care up to 1 year following delivery is required to ensure safety. Health disparities are disproportionately high among pregnant women of color. When compared to white women in predominantly white communities, women in predominantly Black communities have 63% higher rates of severe maternal morbidity. Women in predominantly Hispanic communities have 32% higher rates of severe maternal morbidity. Why are these disparities in severe why are there disparities in severe maternal morbidity rates? Health disparities are the result of a complex fabric of social, racial, and economic factors. Maternal health disparities are often incorrectly thought to simply be related to differences in access to healthcare or socioeconomic status. The social construct of race is an independent risk factor in severe maternal morbidity. This means that race, independent of everything else, is in and of itself a risk factor for severe maternal morbidity. We know that severe maternal morbidity is increasing for all women. However, the prevalence of delivery complications is 46% higher among Black women versus white women. Examples of delivery complications include abnormal bleeding, sepsis, which is an overwhelming infection, blood clots, pulmonary edema, which is fluid in the lungs, kidney failure, preeclampsia, eclampsia, and shock. Maternal health impacts both the mother and the baby. Many causes of infant mortality are the result of maternal pregnancy complications. A recent study in the American Journal of Obstetrics and Gynecology looked at racial disparity in military service members. In this population, there is a diverse community with similar socioeconomic status and equal access to healthcare. The expected results of the study was that when you control for healthcare access and socioeconomic status, there should be similar rates of maternal morbidity regardless of race. This was not the case. Instead, they identified significant disparity between Black and white women in the rates of cesarean delivery, in the number of ICU admissions, and severe maternal morbidity within our United States military training facilities. These findings were surprising to the authors of this study because popular theories regarding maternal race disparities in the US typically include access to care and socioeconomic status, both of which were effectively controlled for in this study. These results reaffirmed the presence of disparities in maternal outcomes for Black women in the United States. This study highlights the need to address other factors which impact the obstetrical outcomes of women based on their race. Examples of these other factors would be things such as system-based barriers and systemic or implicit bias, which occurs within our healthcare delivery systems. Further investigation must be done to try to identify these causes of maternal disparities within the US military population and the larger maternal population in the United States. In addition to the US military study, we see the same thing all too often in our popular culture in the US. We see extraordinarily healthy and physically fit women with high socioeconomic status, wealth, and unfettered access to healthcare experiencing the same maternal health disparities. Tennis legend Serena Williams and entertainer Beyonce, to name a few, all suffered severely complicated pregnancies and postpartum courses. Most recently, US Olympian Tori Bowie died in childbirth. All of these women had one thing in common: they were Black. To quote a recent article on the death of US Olympian Tori Bowie, fame, physical health, and financial prosperity couldn't save them from the troubling statistical reality of being Black and pregnant in the United States. So, knowing all of this, where do we go from here? A huge problem that Black women complain about during pregnancy is the failure to be heard. Their complaints and concerns were often routinely dismissed by their healthcare providers. We must teach patients and their families how to advocate for themselves. We must also educate employers and healthcare professionals to recognize the role that they play in adverse maternal health outcomes. Providers must learn to practice competent and culturally sensitive care. The bidirectional exchange of information should be encouraged. Providers must understand that there is a dark history between the medical profession and people of color. As a result, intentional outreach must be encouraged. At Excellus Blue Cross Blue Shield, health equity is one of our top priorities. We are proud of the work that we do in the maternal health care space. We focus on three areas: engagement, education, and empowerment. We are part of the Blue Cross Blue Shield Association, and we are working with them to advance their health equity strategy. At the same time, we are working with our local communities, providers, and members. We have a multi-year strategy focusing on areas that disproportionately affect our communities of color. Our strategy includes reducing maternal health disparities by 50% in 5 years and reducing disparities in behavioral health, diabetes, and cardiovascular health. We launched the Maternal Member and Community Health Improvement Grant, which allows us to do meaningful work in the maternal health space. We provide bias training to providers and employees working in maternal health. This allows us to ensure that our members receive the care that they need and deserve. We launched a maternal health equity committee, and this ensures that we are able to address the entire continuum of maternal health issues. If you would like more information on what we are doing at Excellus Blue Cross Blue Shield, go to bcbs.com to view our maternal health information and our Maternal Health Compendium. You can also go to cdc.gov and search under maternal health. Thank you for your valuable time and your desire to become more educated about maternal health equity. Please stay tuned for further discussion with our panel of experts. I am certain that their presentations will enlighten you even further on this most important topic. Thank you.